So yeah, no, Wally's going to come on Monday night for dinner.
Simple moments like these are something Dr. Frank Plummer says he'll never take for granted. For over the past decade, he has fought alcohol use disorder. Similar to some Canadians, he was high functioning. It started when he was pioneering research in Kenya around the height of the HIV/AIDS crisis.
So I was constantly writing, and then you're dealing with patients, and you're dealing with death, and you're dealing with some of the pressures of living in Nairobi. So yeah, it was pretty stressful. You know, I used whiskey to kind of relax, and maybe 5 or 6 drinks a day in the evenings.
After returning to Canada, Frank continued his world-renowned scientific leadership and work, contributing to Canada's Ebola vaccine. Publicly, the accolades poured in, including receiving the Order of Canada. Privately, his drinking escalated to about 20 ounces of scotch a night.
I was like a quiet drunk, sit in the corner and think.
He says the true scope of his drinking hit him after needing a liver transplant. But despite various attempts at rehab and other treatments, nothing worked. Frank turned to what he knew best, science. He started to research his own condition. That's when one of his doctors told him about a groundbreaking new trial at Sunnybrook. In 2018, Frank agreed to be patient 1 in a North American first surgical trial using deep brain stimulation, or DBS, for treatment-resistant alcohol use disorder, a condition that affects about 14% of Canadians. Guided by his brain images, Sunnybrook surgeons targeted specific areas in his brain with 2 electrodes.
How do you feel there, Frank?
A little bit more awake, maybe.
And talked to him throughout to make sure they hit their mark. Principal investigator Dr. Neer Lipsman says these electrodes are controlled by a pacemaker-like device that sends electrical stimulation to the brain to try and ease symptoms and cravings. He says exploring new options is critical for this condition, knowing that about 75% of patients will relapse with traditional treatments. This study, which will include 6 patients, is testing how safe and effective DBS is.
The way that I describe it to patients, it's not a light switch, it's more like a dimmer. And it happens over time, weeks and months really, to start detecting changes.
Frank says that's exactly what happened.
Yeah, I drink, but just in moderation, and I don't have the craving that I used to have.
His wife Jo says DBS has been different from other treatments because it addresses treatment-resistant alcohol use disorder as a brain condition rather than an issue around executive function and willpower. It also provides clinical and neuroscience insight to the inner workings of brain function and impairment.
I think that understanding that distinction between brain health and mental health is really, really important as we go forward to address addictions.
Now we'll just double check how your deep brain stimulator is working at.
Now, Frank continues to undergo regular follow-up testing at Sunnybrook. He says he's gone from a place of waiting to die to living more fully in every aspect, busy working on a promising HIV vaccine candidate and reconnecting with friends and family.
You know, the procedures transformed me, and you know, it's given me my life back. It's one of the best things I've ever done.
He says he hopes sharing his story will help destigmatize the conversation about alcohol use disorder, as well as improve the science and understanding around it. With Sunnyview, I'm Monica Matys.